prevention, treatment and care services after freezing of the U.S. government funds remains one of the key issues countries like Kenya continue to grapple with. The impact of the executive order creating confusion, panic and uncertainty amidst a 5.24 billion shillings funding gap to sustain HIV services in the country. On this episode of Health Digest, Gloria Milimu interrogates whether Kenya is able to transition from the U.S. government funding in a bid to ensure the well of its population living with HIV. Take a look.
The landscape of international aid is shifting, with the United States reevaluating its funding priorities. For Kenya, where foreign aid has long been a lifeline, the impact extends far beyond finances. In the sprawls of Kibera slum in Nairobi, we meet with 24-year-old Zipporah Achieng, who is the poster child of the impact of the freeze on people living with HIV in the country. She is among the 1.4 million people who are now confronted by the aid freeze.
Tunasikianga the rate of HIV is high, watu nadhani ni jokes. This time inaenda kuwa high. Many reinfection. Hizo stories za sainda wa madaktari wanagoma. Hata ukikuwa na reinfection utaenda wapi? At least USAID walikuwa na madaktari wao personally. Hawa kigoma, nyinyi story yenu inaendelea. Sasa tunarudi from zero. Unaona? Hapo ndio OIs itakushika. Like our immune system will go down, any disease will take us away.
For many living with HIV, the fear of treatment disruptions continues to give them sleepless nights. Achieng, who has relied on free ARVs since birth, worries about a future where she may have to pay for the drugs that keep her alive.
No one will buy. Nani atanunua dawa na wewe mwenyewe hata hujalipia mtoto wako school fees mali huko. So unapata like mi kitu inanikasirisha bed. Hata nikiongea hapa na feel like vibaya kwa sababu wame take time. Unaona? Na sasa tujui fate ya huyo Trump ni gani.
Launched in 2004, President's Emergency Plan for AIDS Relief PEPFAR has been critical in global health efforts, saving over 20 million people around the world, particularly in African countries like Kenya. Experts warn that the U.S. funding freeze could cripple PEPFAR-supported programs, exposing the country's reliance on foreign aid and leaving patients like Achieng to bear the brunt of the crisis.
Hata si wenye tukiangalia government yetu tunaona haiwezi, even though they will tell us, but still we are into fear.
The 90-day suspension of U.S. development assistance, ordered by President Donald Trump, has left a gaping financial deficit, threatening hard-won gains in the fight against HIV. Kenya needs at least 5.2 billion to sustain HIV services in a bid to avert the over 20,000 AIDS-related deaths recorded annually and prevent new HIV infections. Overall, 30 billion shillings is required to sustain the vulnerable health programs that relied heavily on donor funds. The growing need to inject more funds into HIV response, encompassing human resources for health, commodities, data and service delivery systems, supply chains and logistics management, now remains the biggest task for Kenya in the wake of the U.S. president's move.
Even in our constraint, in our own constrained fiscal space, we must set aside some money to go towards this program.
In our revenue allocation formula, is there a possibility that we can consider additional allocation to counties, the 10 of them with a high disease burden?
Whereas a high-level meeting held in Nairobi was to help remedy the current financial dilemma, it only seemed to have opened a can of worms.
I don't want to really confirm that I have any solutions as of now concerning the budgetary allocation, but we will continue having the engagements.
With all due respect, my sister, for you to say you don't even have a brief, and we have come to discuss the issue of the money, what then way forward would we be having when we have called governors from their respective counties to be here?
We are talking about a very serious matter. in this country. And therefore we expect some seriousness from Treasury, National Treasury.
Unajua the more wanavutana, the more infection inafanyika, the more new infected wanafanyika. Walisema dawa iko za 6 months. Undani HIV tangoja mpaka 6 months ifike ndo ianze kuongezeka.
The annual cost for treatment per patient is said to be 15,000 shillings. It is estimated that over 200 million shillings was required for ARVs to sustain the 16,752 new infections that year. The government, however, says the country has sufficient stock of life-saving medications. But is that enough for the likes of Acheng, who requires to be on the lifelong medications?
We have adequate supplies of TLD, pediatric ARVs, nevirapine suspension, and other HIV testing commodities.
At least for first line, what we have in country today is 5 months in national stocks, 2.5 months in the facilities, and in the pipeline, which is what is being shipped in now, 7 months.
As countries navigate the impact of the executive order, experts say increasing health investments through domestic resources and local solutions is imperative to secure long-term health and well-being of the over 1 million people living with HIV in the country. Gloria Milimu, KTN.